Good afternoon, everyone. I am Dr. Allison Matthews. I'm the Executive Director of the Faith Coordinating Center at Wake Forest University. We are so excited to see all of your faces. I see some familiar ones and some new ones. Today, we will be running through giving an overview of our different funding opportunities that are currently available. The funding portal has opened as of April 4th, and the deadlines are May 2nd. So we encourage you all to go ahead and start creating your accounts and start kind of plugging in information for your applications now, reviewing the RFPs. But we're going to go through some of that content today and happy to answer questions for you all. So at the Faith Coordinating Center, just want to give you all just a broader overview of the Faith Coordinating Center and what we've been doing over the past year. So the Faith Coordinating Center was founded in January 2021. And so we are just over a year old with our center. And over the past year, we have been really intentional about working with funded partners who have been able to make a significant headway in being able to work with faith communities and train faith leaders on how to address stigma around HIV in their communities. Many of the organizations that we have worked with have ranged between, a small 1 to 2 people organization that's working in their local community, all the way up to national organizations that have actually established partnerships with about 15 HBCUs across the South. So we have quite a big range of organizations that we've been working with, all with the goal of working to transform the story of HIV/AIDS in faith communities to respond to the HIV crisis in the South specifically, and promote positive health outcomes. And what we mean by transforming the story, recent research has shown that there are at least 18,500 churches that have people living with HIV as members. And there are about 10,000 churches estimated to have done any kind of programming related to HIV. But the problem is there's not sustainable programming. It's very low awareness. They're not connected to each other. They may even be implementing programming that induces additional harm in their communities because they're not fully educated about the latest in HIV research and connected to faith, connected to medical institutions and reliable sources. And they're not connected to each other, and they need that support and they need the access to funding to keep that work going. And so with the Faith Coordinating Center, we are, part of a 10-year, $100 million commitment by Gilead Sciences, which is a part of the COMPASS initiative. And the COMPASS initiative in particular focuses on addressing stigma and addressing the HIV epidemic and inequality around the HIV epidemic through different aspects of it. So addressing stigma around HIV, addressing policy-related issues around HIV, trauma, the trauma-informed care, and providing mental health support and substance abuse support, and also capacity building for nonprofit organizations and faith-based institutions so that your organizations can grow and be more sustainable, and also secure additional funding beyond beyond the funding that we already provide you. So with the Faith Coordinating Center, our main 3 focus areas are storytelling, partnering with experts in HIV, faith, stigma, health, healing, mental health, and music, developing social media and communications, campaigns and materials and toolkits for faith faith communities, and partnering with artists and national media to amplify messages. This past year, we actually established a partnership with Lil Nas X, and he invited us to come to the MTV Video Music Awards, and one of our Compass colleagues was on stage during the performance and had on a jumpsuit with the number. He had numbers on his back, and those numbers represented the number of people living with HIV in the South as of 2015. And so that was a small thing, but it was, it made national news and continues to make national news, that partnership that we have with Lil Nas X. And over the course of the year, we've also been able to raise an additional $500,000 in partnership with Lil Nas X to support Southern nonprofit organizations addressing stigma around HIV. So that's what we're talking about when we're talking about amplifying messages and creating more sustainable mechanisms to support this work. In addition to the funding, we require all of our funded partners to participate in trainings. So we have monthly trainings that we provide that give you updates on HIV/AIDS, give you training from biblical scholars and theologians on the biblical and spiritual training, and how to talk about healing, how to talk about sexuality, how to talk about trauma and spirituality in ways that are more inclusive of our LGBT siblings, as well as people living with HIV. We also do trainings on how to build out community engagement strategies and sustainable programs in health ministries. And also, one of our priorities for funding this year in particular is to help with faith-based institutions and nonprofit organizations to help build out health ministries across the South, and to address the social determinants of health. We do recognize that, in addition to the faith leader having, training and talking points and things like that, it's really important for the faith community to also have an infrastructure to address the health needs of their communities. And so that is one of the health one of the funding priorities that we have for this year. In addition to, funding communications and educational programming. So I want to also mention that we have a new funding opportunity this year. And I'll go into that in a second. This is our staff. Shauna Jones is the principal investigator for this center, and I'm the executive director. And so we work together for visioning and strategic partnerships and strategic planning for the center, as well as, directing a lot of the programming that we do in the national partnerships. Demi is the creative program manager. Marcus is the educational program manager. Mia Sloan is our faith project manager. We have a postdoctoral fellow, William Boyce, who teaches courses on campus in the Divinity School. And then Diane Cox, who many of you all will probably be emailing a lot with, who is our finance and data analyst and helps with securing all the documentation and processing of payments. These are our previously funded partners. Like I mentioned, we have a range from local all the way up to national organizations. We do prioritize funding in the South, and so the majority of our organizations are located in the South. We also are trying to prioritize organizations that are in rural areas, or that are and that are BIPOC-led, Black, Indigenous, people of color led organizations. That, of course, does not preclude organizations from other non-Southern states or from non-minority organizations to apply. However, just with, you would need to make a very strong case that you are serving minority communities, and or you have a board, a representation that is diverse, and that you are working with organizations and have strong relationships in the South. These are some of our national partners, local and national partners. We, of course, being a part of Wake Forest University, are connected to Atrium Health, Wake Forest Baptist, the U.S. HIV and AIDS Faith Coalition, that is a national coalition of faith leaders and faith-based organizations doing HIV work. Old North State Medical Society is a medical society based in North Carolina that is historically Black founded organization that works with Black medical providers. And so we tap into them a lot for expertise on HIV as well as other health conditions. And we are in the process of launching an ambassador program with them to work on helping train faith communities to talk about HIV. We, of course, also work with the UNC Center for AIDS Research to conduct research, and the Balm and Gilead is another national nonprofit organization that is actually the founder, Pranessa Seal, is the founder of the National Week for the Healing of HIV and AIDS. And so they are a very strong partner for us in connecting with health ministries across the South. So our funding opportunities. This Learning It Together Artist Cohort Grant is our newest opportunity. With this grant, we are we're focused on, and the goal is to fund around 5 artists in addition to an artist in residence who would actually be funded at the $40,000 level. So with these artists, we would have monthly meetings with them, and we want to fund artists and or arts-based organizations that are committed to addressing promoting diversity and addressing stigma around HIV and AIDS in the context of faith. So an artist doesn't necessarily have to have already been doing work around HIV, but can make the case that their work is very relevant and connected to it, and the themes are relevant to this topic. And that, I think, is the same for any organization. We did have several organizations who this was their first time doing HIV work. And that is, we encourage that because we definitely want to be able to reach different communities and networks. We just want you to make the case that, your work is relevant and connected to the themes that are related to HIV and what make people vulnerable, and in ways that you can expand your work to address HIV/AIDS. So it's a cohort-based educational program. It will be led by Demi McCoy and Dasana Hanu and Marcus Hawley and myself as coaches who would walk the artists through how to expand their careers and make sustainable kind of career opportunities for themselves. That we may also partner the artists with other organizations that we fund or who are in our network to provide opportunities for them to showcase their work. That $25,000 is to protect their time so that they can focus on either expanding or producing work that reflects the themes of HIV and faith. We'll also be providing some trainings on just the basics of HIV and the themes around faith and theology and trauma and how to incorporate that into creative work. Excuse me, sorry. Now I don't know how to get back. Okay, so so that is a funding for 12 months and bi-monthly meetings. I think it'll be monthly, not bi-monthly meetings. We have the Faith Action Grant, which is also $25,000. This is for maybe smaller organizations that maybe this is, or an organization that hasn't done any HIV related work before, and they want to use this as pilot money to get their projects off the ground. Or for smaller organizations that, maybe this is your first grant or your first major grant, and this is an opportunity for us to help you expand the capacity of your organization to address HIV or to address faith-based initiatives. So nonprofit organizations, in part, you have to make a case for the strong connection with faith communities. We're looking for action-oriented projects centered around reducing stigma, trauma-informed care, or aging and the perception of HIV/AIDS in the South. Some of the organizations that we funded in the past have done podcasts, have done radio shows, and done billboards in their local communities. They've also done trainings with faith leaders in their network, and also incorporated educational programming in their organizations or with their networks. Also, maybe you're a faith community and you're looking to advance and develop programs and initiatives or conduct research on your local religious communities to promote positive health and faith and health outcomes, especially around HIV. Maybe you have a housing or transportation program that supports people living with HIV, or a support group or something like that. I think that would be a good fit for this type of work, or to get your health ministry off the ground, or to expand your health ministry in that way. The transformative grant opportunity is an 18-month opportunity. So it would start from July 1 and go to December 2023. So this opportunity is for larger organizations. With this level, we're looking for organizations that have a statewide reach or cross-state reach, multi-state, multi-city reach, have larger networks. You definitely would have to demonstrate that you have the organizational infrastructure to handle $100,000. So, having an accountant, having staff, those, and having kind of also previous work connected to this, that to demonstrate that you can hit the ground running and make an impact in this work, and that you already have the partnerships. And so this money would then help amplify that for you. And also we want you to demonstrate that this is going to be transformative for your community. So innovative ideas, collaborating with Christian and interfaith partners, creating inclusive faith spaces, creating opportunities for physical, emotional, and financial wellness, educating emerging faith leaders and communities who will impact how communities respond to HIV in the future. We have another more in-depth information session for the transformative grant opportunity that will be on April 14th. This opportunity is released and conducted in collaboration with our other coordinating centers. So there are 4 coordinating centers total, including Emory, Southern AIDS Coalition, and the University of Houston, as well as Wake Forest. And so we usually launch the transformative grant along with those other coordinating centers. And so we're going to have an information session in collaboration with them. I know the one question that we get a lot about the transformative grant is that in previous years, if you had a transformative grant from another coordinating center, you would not have been eligible to apply for one with our center if it was currently active. However, this year we decided that if you are an organization that can make the case that you have enough staff and capacity to handle multiple transformative grants from multiple CCs, given the fact that we, have our own expectations and deliverables and reporting and evaluation and all of the intensive requirements for the transformative grant would be the same for the other CCs. If you can make the case that you can handle those, then we are allowing you to apply for transformative grants from multiple organizations, from multiple CCs. Okay, the faith capacity building grant is our largest funding opportunity. It is up to 200,000. The previous ones, when you're submitting your application, we are expecting that you submit a budget at 25,000. So you need to make sure that your budget fits the 25,000 or that it fits exactly 100,000. With this one, it could be less than 200,000 or up to 200,000. This one, we are only funding 2 organizations at this level, so it's a highly competitive. The transformative grant, I think we are looking to fund between 4 to 5, and then at the faith action level, I think also looking to fund 4 to 5 organizations. So with the capacity building, this is, we're looking for national organizations that again, have a pretty expansive reach. One of our current capacity building funded organizations, has done mini grants with its 15 HBCUs across the South, and they've basically granted out the money to representatives from the HBCUs so that they could learn more about HIV and interfaith leadership and integrate programming and course material so that they could start creating more programming on their HBCU campuses. So that's the kind of magnitude that we're looking for when we want to support a capacity building grant at this level. All of this is with the goal of partnering with us. We call our grantees funded partners because we imagine that we are putting this money in your hands in partnership with us so that we can create a movement that allows faith community, that enables faith communities to address and educate others about HIV stigma and to create safe spaces and to stop this traumatized experiences that people living with HIV and LGBT folks experience in faith communities. We also want to create a national network of faith communities who are committed to doing HIV related work. And we are in the process of revising and relaunching the national Black Church and HIV Social Justice Imperative. It's an initiative that was originally started by NAACP. And so we as the coordinating center are now taking that project into phase 2 and building out a network of faith communities that are doing this work and creating additional opportunities for capacity building and collaboration and partnership. And so the funded partners that we work with, we want to be intentional about working with funded partners who can help us make that a reality. And so with that in mind, we would love to see applications that have this vision on how to really change the culture in our faith communities, and particularly Black faith communities and interfaith communities to address the stigma around HIV. So you can submit your applications to gileadcompass.com. On the top right-hand side, there is a button that says apply for funding. and it will take you to it'll take you to the application portal and you're going to have to create a user profile and click on the funding opportunity that you want to apply for. I would not suggest that you apply for multiple funding opportunities in different categories through the Faith Coordinating Center. I think you need to review the RFPs, review where you are as an organization, and make a decision about which one is the best fit for you at the place that you are right now. If you submit multiple applications through us, through multiple funding opportunities, it probably will count against you. So I just want to say that up front.
So can I ask a question?
Sure.
So the artist cohort program, right?
Mm-hmm.
What if I want to submit as an artist, but still have to put my organization down that I'm sponsored by in music? Because I know my organization probably want to submit their information for another program, for something that they want.
It has to be different than what you are doing as an artist. So if you have a fiscal sponsor organization that is interested in also applying for funding separately, then their project has to be different than what you are applying for.
Okay. Yes, ma'am.
Mm-hmm.
But you also mentioned the partnership with the artist and the organization.
Yes. Is that a question or is that just a clarification?
Can you elaborate on that partnership?
I'm sorry?
Can you elaborate on the partnership and with the artist and the organization a little?
Okay, sure. So with the artist cohort, the artists must be you cannot apply as an individual for this funding. You have to be connected to a nonprofit organization as a fiscal sponsor. What that means is if you have your own nonprofit, you can apply with your own nonprofit. What that means is, as an artist, if you have a fiscal sponsor, you would input that fiscal sponsor's information to create the profile for the application portal. But then the rest of the information that you are submitting for, like your personal statement, your artist statement, and your project would be your information as an artist. If you are applying as an organization to this artist cohort, you would include the organizational kind of vision. So I think, for example, there's one organization that reached out to us thinking that they have a play that they would put on that raises awareness about HIV in there, and it's got some faith themes in it. And they would work with students to put on the play. That they would apply as an organization and put in all their information and their vision for the project as the putting on the play and mentoring students. If you're an artist that is like a spoken word artist, for example, or a visual artist, you would put in the fiscal sponsor's information just to say, this is the 501c3, this is their address, this is the executive director's information. And then you would input your personal statement as you as an artist and you as your vision for your project and how your work is connected to the themes personally. Does that make sense?
Yes, it makes very much sense. And the organization is not required to be in the South, correct?
All of the organizations, we are prioritizing funding for organizations in the South. If you are not in the South, you need to make the case that your work is going to be focused in the South, have an impact in the South, and that you have a partnership with a Southern organization.
Well, the artist is in the South, so would that count as an entity?
Yeah,
partner?
that's fine. Mm-hmm. So I think this slide just kind of goes deeper into what I'm already talking about, clearly articulating how your project addresses, serving or working with or impacting people living with HIV and connected to faith communities. Or if your organization has a faith-based initiative or something like that, just highlighting that. We did have some organizations that didn't really make a strong connection or demonstrate that they had a faith connection or a faith component. So, it's just making sure that you include that in your application, in your narrative. I think having a letter of support from partners saying, if this organization gets funded, we are fully committed to working with them to help make sure that this project is a success. Having a letter of support like that is only going to strengthen your application. Clearly articulate how you will deliver the program. So we want to see, how many, what's the timeline? It has to be a year-long program. We want to make sure that you have plans for, getting it established, when you're going to implement it, how many people are you going to reach and engage with this program? What are the deliverables? How are you going to communicate? Are you going to use social media and websites? You're going to use email campaigns? You're going to work with radio? Making sure that you have all of those plans laid out in your application. And like I said, we are committed to supporting grassroots organizations and grassroots campaigns. So don't take yourself out of the running. We encourage you to apply. Eligibility, 501c3 organizations operating in the 12 Deep South states, Alabama, Arkansas, Florida, Georgia, Kentucky, Louisiana, Mississippi, North Carolina, Oklahoma, South Carolina, Tennessee, and Texas. If you note, it does not include DC, Virginia, and Maryland. Even though we know that those are in the South, those states tend to get a lot of funding for HIV related work. And so we're really prioritizing putting funding in these states that don't get as much funding. Like I mentioned before, if you're in DC, Virginia, or Maryland, just make sure that you have a connection to these other states to be eligible to be considered for funding. Sorry. Okay. And like I also mentioned before, with the different funding categories, don't apply for less than $25,000. If it says $25,000, apply for $25,000. We want you to make sure that, you get the money and the support that you need. Okay, all applications are due May 2nd. May 2nd so if you're in Central Standard Time, that would be May 2nd at 11:59 p.m. If you are in Eastern Standard Time, that would be actually May 3rd at 12:59 a.m. So you get a little bit of an hour. So we will send out notifications in June, and the work will start July 1. This is the grant cycles. Like I mentioned, the transformative grant cycle is from June 30th to December 2023. And I want to also be clear about the expectations of our funded partners. You're required to submit quarterly activity reports. These in order to complete the reports, you have to collect data. And we are supplying our funded partners with templates on how to collect the data and the surveys that we want them to use to collect the data. And then they are then going to submit that in their quarterly reports as summaries of the impact of their work and how far and where they've gone, what challenges they have, what their strengths are, and things like that. Okay, and then you're required to report on your budget and your spending at the end of the year. Actually, for each quarter, you have to report on how you spent the money. We are not allowed to fund anything that supports the use or purchase of medications, direct medical expenses. So, you know, a lot of times other grant opportunities will allow you to do like cover people's co-pays for things. That's not this kind of funding. We cannot support that because it comes from Gilead Sciences, which is a pharmaceutical company, and we have to have a separation between their operations as a pharmaceutical company and the funding that we are doing to support nonprofit organizations. You cannot cover deficits, funding deficits of an organization, no biomedical research. We cannot fund projects that influence Gilead's business. And part of that is talking about PrEP. None of your organizations, if you get this funding, would be allowed to have conversation or promote PrEP. You can talk about HIV prevention medications in general, but you cannot necessarily go out and tell people or encourage people to get on PrEP. Individuals and we can't support individual healthcare providers or physical group practices, events or programs that have already occurred, or lobbying. If you are looking to fund like a conference or like something like that, we encourage you to apply directly to Gilead. They have way more money than we have as a coordinating center, and they do often fund conferences, and so we support you going directly to Gilead for that kind of financial support. We are looking to fund projects that go throughout the entire year and not just one-off events. The documents needed for the application are a W-9, your letters of support, obviously your proposal, and the application has the questions outlined for you. And I think if you go to our website, we already have the PDFs of those applications with all the questions that you can go and look at ahead of time and download. We do suggest that you prepare it in a separate Word document and then just copy and paste it into the portal. You need your 501c3, or your letters of support from your fiscal sponsor if you have a fiscal sponsor, your organizational operating budget. So people ask, as a faith community, do I need to submit my faith community's operating budget? Yes. If you're a part of a larger organization, but you're only applying for this one little small project, but you're a part of a larger organization, still submit that larger organization's operating budget. You can include maybe a comment that says you don't have access to all of that money, which is totally fine, but we do need that information. We need your grant budget and your budget narrative, and the template for the grant budget and the budget narrative and for the work plan should be accessible in the RFP for you to download. Either that, or there's a link in the actual application on the portal that allows you to download it and make edits and then re-upload it. If you have questions or challenges using the portal or technical difficulties or anything like that, you can email us, compass@wfu.edu. Okay, so now I'm going to stop and see what the questions are.
So Dr. Allison, we had a couple questions early on in the chat, somewhat similar, but one of the questions from Terry Moore Brown, I believe, is are HBCUs eligible to apply?
Yes.
All right. And the next question is, did any of the previous programs awarded deal with children? Specifically, my nonprofit in New Orleans serves young performance artists, and that's from Charles McCall.
They didn't, but that doesn't mean that you couldn't apply, and we would love to see something like that, people working with the youth. Is there a fixed number of grants being awarded in each category? No, there's not a fixed number. We kind of estimated that we would fund about 5 artists plus an artist in residence. We would fund about 5 faith action grants, about 5 transformative grants, and about 2. That's just an estimate. But depending on the strength of the applications, we may move things around. But we have a total of $1 million that we have to grant out each year. And so it will be, that's the limit. That's all we have. So it depends on, the strength of the applications that we get. Any other questions? Do you all want feedback on some of your ideas? I'm happy to answer some of those questions now as well. So when you're talking about expanding health ministries, is a particular requirement for the expansion? No, not necessarily. What I mean is maybe you already have a health ministry that's established, and maybe you haven't done anything around HIV in your health ministry. And so you want to use this funding to do intentional programming or to intentionally work with people living with HIV and minister to them. That would be a great thing. Or maybe you want to connect your health ministry to a local health department or to a local, health system and minister to the people living with HIV in the health system. Maybe you want to expand it so you can do HIV testing in your communities. So those kinds of things we would love to see. Or maybe you're already doing ministry with people living with HIV and you want to support transportation or housing or things like that. That would be kind of the expansion of that. Any other questions? Feel free to come off mute if you want.
Hi, Dr. Allison. I have a question.
Yes.
I'm working with a nonprofit that is, we do most of our work online. So with that, if some of the work that I did specifically that I led with the organization were done in one of those 12 states, would that work? Because technically the nonprofit I think is based in Minneapolis, but we have folks all over because it is an online based organization, faith-based organization.
Mm-hmm. Yes, I think that would be fine. You just have to make sure that you have a strong connection to a southern southern office or something like that. One of the comments or one of the decisions we made was that if you are not based in the South, the funding would have to go through your southern office or your southern connection. So take that into consideration.
How do you define strong?
Showing a letter of support from your southern partnership, or just making the case that you have a connection and that you're planning to work with them on that work and that you're planning to serve people in the South.
Long-standing relationship for the most part.
It doesn't have to be long-standing. It could be a new relationship, but I think having the agreement and the plan on how you're going to work together is important.
How long have you all How long have you all been awarding grants?
This is our second funding cycle. But I've been working on grants for almost a decade, or over a decade.
We have another question in the chat. Can funds be used towards payroll to staff for particular programs, i.e. teachers, production staff, et cetera?
Yes, yes, it can. Any other questions?
I have another question. Is there anything, and I apologize if I missed this, but are there structured resources in place to help us continue the project beyond the life of the grant?
Yeah, so usually part of the training opportunities that we offer are helping you think through grant writing. And we also we try to be very intentional about sharing funding opportunities when they come across our desk. We do provide opportunities for funded partners to attend conferences and to present on your work and to network. And we, again, like I mentioned, applying directly to Gilead. A lot of times we can put in a good word as a recommendation to Gilead for you to secure additional funding.
Another question in the chat. When you say you can help with transportation, are we able to apply to assist people living with HIV with gas vouchers and or utility bills?
Yes, I believe so. I think that would be fine. They just can't pay for their copay or their medication. So for the current funded partners, because I see a few of you all who are on the call, I think I pasted the link to the chat for our website that has information about the funding opportunities. And also if you go to gileadcompass.com, it sends you directly to the portal. You click on the button apply for funding in the top right, and it will send you to the portal, and it has the request for proposals. So it outlines all of the elements and the kind of what we're looking for in the proposals, and it outlines all of the documents that you need and all of that for each grant opportunity. So go to gileadcompass.com for that information. For our current funded partners, I want to also say that it is important for you all to demonstrate how how your current project has made an impact, and then how you're going to build upon or do something new, or expand what you're already doing, so that you can make the case why this funding would help you build and expand on what you're already doing. We're not necessarily interested in funding the same thing that you did last year. Is our program set up to be longer than the grant period? Is a renewal grant a possibility? Oh, if your program. So like I mentioned, so we have funded partners who are on this call. They will be applying for additional funding, I imagine. I would not call it a renewal, because a renewal would mean that they're doing the same thing over again, and they're just applying for money to keep doing that. What I would call it is additional funding to support and expand the work that they're doing. So yes, you can apply again, but it would, you just have to make sure that you show that the work you're doing is making an impact, and that you're expanding it. So also, I want to let you all know that there are we are not the only coordinating center. So there are funding opportunities through Emory. Emory provides capacity building, so it can give you training on how to build out your board and how to write grants and apply for grants. The University of Houston has funding that focuses on trauma-informed care, and it walks you through how to make your organization more trauma-informed. And they have mental health and substance abuse kind of funding as well. So maybe you have programming in that way. And so if you have multiple kind of initiatives that would fit those other categories as well, we do encourage you to apply for funding through them. That, you know, applying for funding through us does not stop you from applying for funding through them. Any other questions? All right, well, we do thank you again for joining, and we look forward to your applications. Don't hesitate to reach out to us if you have additional questions. compass@wfu.edu. Thank you. Y'all have a good afternoon.
Thank you.
All right, you too. Thank you.
Thank you. Have a great day.
Thank you.
Thank you.
Thank you.